You know, it's a question that drives so many parents crazy. Is my child just ignoring me, or can they actually not hear me? Well, today we're going to talk about a really common condition that's often behind this whole dilemma: glue ear. The official name is otitis media with effusion, or OME for short, and it's one of the biggest reasons for hearing loss in kids. So let's dive in and break down what it is, how you spot it, and what you can do about it.
This is the classic scenario, right? This is what often brings parents into the doctor's office in the first place. You call their name and nothing. They seem off in their own world, maybe daydreaming, and it's so easy to chalk it up to a behavioral thing. You know, the terrible 2s or 3s, but what if it's not that at all? What if the real issue is that they just can't hear you clearly?
So how do you even begin to suspect something like glue ear? Well, the thing is, the signs can be surprisingly subtle. They're often mistaken for something else entirely. It's really about looking for a pattern, a collection of little clues that, when you put them all together, start to build a pretty convincing case.
Okay, let's run through the common clues. A kid cranking the TV volume way up, that's a classic. Constantly saying what or huh? Yep, another big one. But then you've got the sneakier signs. Maybe their teacher mentions they're not really participating in class, or you notice their speech seems a little behind their friends. And here's one that might surprise you. Even clumsiness or balance issues can be a sign. The inner ear is key for balance. So all these things together start to paint a picture.
All right, so you've noticed a few signs, you've made the appointment. What actually happens next? Well, think of your doctor as a detective. They're going to start by asking a whole bunch of questions to piece together the history and figure out any potential risk factors. And these questions aren't random. Each one is a piece of the puzzle. A history of lots of ear infections, that's a strong link. Attending daycare or nursery, well, it just means they're around more colds, which can lead to this stuff. Exposure to secondhand smoke is a really significant risk factor. And on the flip side, breastfeeding is known to be protective, partly because of how it helps keep the tubes in the ear clear. It all helps build that complete clinical picture.
And this visual is brilliant. This is exactly what the doctor is looking for with that little light they use. A healthy eardrum is kind of see-through, it's translucent, and it moves like it should. But an eardrum with glue ear stuck behind it? No way. It gets dull, opaque, and just doesn't move well. A doctor might even be able to see this amber-colored fluid or little air bubbles trapped back there. It's a really clear visual sign that something's up.
So after that initial exam, the next step is to actually confirm it. And the good news is, this is done with a couple of super simple, quick, and most importantly, completely painless tests. This is how we go from just suspecting it to knowing for sure.
But before we get to the tests, let's be crystal clear on what we're actually looking for. What is otitis media with effusion? It's really simple. It's just fluid that's gotten trapped in that little space behind the eardrum. It's not a full-blown, painful ear infection with a fever. This is a much quieter, more persistent collection of fluid that just muffles hearing. It's kind of like trying to listen to the world from underwater.
So the two main tests are tympanometry and audiometry. Tympanometry sounds complicated, but it's not. A little device sends a gentle puff of air to see how the eardrum moves. If it's stiff and doesn't move, what they call a flat or type B reading, that is a massive clue there's fluid behind it. Then there's audiometry, which is basically just a standard hearing test to figure out exactly how much that fluid is affecting what your child can hear.
And let's just focus on that tympanometry test for a second. That type B flat curve isn't just a hint, it is 94% specific for there being fluid in the middle ear. I mean, that is an incredibly reliable and objective measurement that gives doctors and parents a huge amount of confidence in the diagnosis.
Okay, so the diagnosis is confirmed, it's glue ear. Now what? Well, the good news is there's a really well-established playbook for what to do next, and it often starts with a step that actually surprises a lot of parents.
The first thing we do is not to jump into action, but to start active monitoring. You might also hear it called watchful waiting. And let me be clear, this is not the same as doing nothing. It's a deliberate clinical strategy. It's based on decades of research showing that a lot of the time, the body is perfectly capable of sorting this out all on its own.
This timeline shows you what that journey usually looks like. So you get the diagnosis on day 1, and then the standard approach is to wait. You'll probably have a check-in around the 6-week mark. But the big decision point comes at 3 months. And why 3 months? Because the body is amazing. Studies show that for about half of all kids, the glue ear will completely clear up by itself within that time frame. No intervention needed at all.
So, when does the waiting stop and the action start? This is the key benchmark. If after that 3-month waiting period, the hearing loss is still significant, and we're talking a measurement of greater than 25 to 30 decibels, especially if it's in both ears, that's the trigger. That's when the conversation about other treatment options really begins.
Now, the most common surgical treatment is getting grommets, sometimes called ventilation tubes. And honestly, the word surgery sounds way scarier than this actually is. It's a very quick, straightforward procedure. Under a brief anesthetic, a surgeon makes a tiny little opening in the eardrum, the sticky fluid is gently suctioned out, and then this minuscule tube, it's smaller than a match head, is popped into the opening. And all that little tube does is act like a temporary window, letting air get in and stopping the fluid from building back up.
But listen, surgery is not the only option, not by a long shot. Hearing aids are a fantastic non-surgical alternative. They can restore hearing immediately without any of the risks of an operation. You've also got things like bone conduction aids, or even a technique called autoinflation. This is where the kid uses a special device to blow up a balloon with their nose. It sounds a bit funny, I know, but it's a really clever way to use air pressure to help clear out the eustachian tubes. So, whether it resolves all by itself or with a little bit of help, what does life look like after glue ear? Let's get into some of the practical questions and the long-term outlook. This is probably the #1 question parents ask after their child gets grommets. What's the deal with water? And the advice now is that you don't have to be super paranoid. Normal bathing is perfectly fine, and while you might want to avoid diving deep or swimming in murky lake water, there's generally no reason to ban swimming in a clean pool. Okay, let's talk about the risks, because it's important to put them in perspective. Look at this chart. That biggest bar, that's the most common issue, a bit of discharge from the ear, which is easily treated with drops. Now look at the next bar. See how much smaller it is? That's the risk of the little hole in the eardrum not healing up on its own. It's small, somewhere between 1 and 6%. And that final, teeny tiny bar, that's the risk of a serious complication, which is incredibly rare. We're talking less than 0.5% of cases. It's also really important to have realistic expectations. The grommets aren't permanent. They're designed to fall out all by themselves, usually within about 6 to 12 months. And for about 20 to 30% of kids, the glue ear can come back, which might mean another set of grommets is needed later on as they continue to grow. So, after all of this, what is the single most important takeaway? It's really simple. Trust your instincts. That gut feeling you have that something might be a little off with your child's hearing, or their speech, or even their behavior, that's a powerful signal. Never dismiss it. Getting it checked out is always worth it, because it could lead to a simple diagnosis that completely opens up a world of clearer sound and better development for your